We're going to a new phase in this entire process. We talked about early detection. We've talked about testing. We talked about containment. You see those numbers are going up. That means you're moving towards a mitigation phase, and you're moving to a phase where you must expect a significant inflow into the hospital health care system. Now, again, this is the great curve they talk about, plus or minus. Flatten the curve, flatten the curve, flatten the curve. That's what all you hear. That's what you hear every day on TV. You see this curve. We must flatten the curve. The concept is right. Flatten the curve, slow the spread so the healthcare system can handle it. When they say this, I don't think of a curve. I think of a wave. And the wave is going to break, and the wave is going to break on the hospital system. We're doing everything we can to flatten the curve. I believe we've taken more dramatic actions than any state in the United States. I believe we've had the most effective response of any state in the United States. I don't believe we're going to be able to flatten the curve enough to meet the capacity of the healthcare system. So in this business, plan ahead, plan forward, anticipate what's coming down the road and get ready for it. Expanding the capacity of the healthcare system for a state is virtually impossible. Building a hospital is a very elaborate, extensive, expensive undertaking. Again, we need the federal government to play its role. The federal government has tremendous capacity. I was in the federal government. I was a cabinet secretary. I worked with the military. I worked with the Army Corps of Engineers. They have tremendous capacity. This is what they do. This is what they do. They build airports. They build bridges. They build hospitals. This is exactly what they do. Deploy the Army Corps of Engineers to come work with states to build temporary medical facilities. Get us backup beds. So when the hospital is overwhelmed, we can have some of the people who are in the hospital beds go to a backup medical facility. It makes all the sense in the world. And if you don't do it, you know what is going to happen. You're going to overwhelm the hospitals. You only have 53,000 hospital beds. You only have 3,000 ICU beds. Why? Because our health system is basically a private system. They don't build capacity that they don't need. They don't build extra ICU beds just in case. An intensive care bed is very expensive. They don't build a wing of ICU beds that sit vacant for 10 years on the off chance that there's going to be a public health emergency and you'll need the beds. They don't. It's not economic. It's not their business model. So we don't have them. We have the capacity that people use day in and day out. And that's not just New York. That's every state in the United States. You now have this influx. You can't handle it. You overwhelm the hospitals. You have people on gurneys in hallways. That is what is going to happen now if we do nothing. That is what is going to happen now if we do nothing. And that, my friends, will be a tragedy. We know what lies ahead. Look at the numbers from China, South Korea, and Italy. You don't have to guess. You just have to project. The numbers are on a chart. Our numbers are on a chart. Just extend the current trajectory. Just go dot, 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 and you'll see the numbers rise, and you compare those numbers to our hospital capacity, and it's still math at the end of the day, and it doesn't work. The federal government must do this. Assume the federal government doesn't do what the federal government is supposed to do, which would not be a wild assumption, as it hasn't happened to date. Well, then, as a fallback, the states have to do whatever they have to do. And the state has to mobilize to create backup medical facilities. And that is what we are going to do. We're going to organize the National Guard, work with the building unions, and work with private developers to find existing facilities that could most easily be adapted to medical facilities. Meaning what? Meaning dormitories, meaning former nursing homes, facilities that have that basic configuration that could be retrofit. Even that is not easy, because you have the construction element and you also have the equipment element. It is very, very hard to get medical equipment now, because everybody on the globe is trying to buy the same medical equipment. Everybody wants to buy a ventilator. Everybody wants to buy oxygen. Everybody is trying to buy the same equipment, and it's terribly scarce. That's why I go back again to the capacity of the federal government, which operates and maintains a medical emergency stock where they have stocked medical equipment for domestic issues or for wartime, right? When you go to war and they set up a wartime hospital, they have equipment. They have it stockpiled. That's why they're uniquely suited to do this. But in any event, we're going to do the best we can. I need, first and foremost, to find available facilities that can be converted. And I'm asking local governments, especially in the most dense area, to immediately identify a number of beds in facilities that are available. Frankly, I hope they're surplus, because we don't have, this is very expensive, and I don't want to pay money for acquisition of property and real estate. But we need the communities that are most effective to begin finding available beds. New York City, we estimate conservatively, we, at this point, should identify 5,000 additional beds. Nassau, 1,000 additional beds. Suffolk, 1,000 additional beds. Westchester, 2,000 additional beds. Why more for Westchester? Westchester has the New Rochelle cluster, which, as you know, has a significant number of people who tested positive. We will do everything we can, but we need federal assets and we need federal assistance. I am very proud of this state government and what it can do. And we have done things that no state government has done before. We built bridges, we built airports, we've responded to emergencies. But know what you can't do. We don't have the billions of dollars that you would need to implement an immediate emergency hospital construction program. This state can't do it. No state can do it. To increase hospital capacity of the existing hospitals in the meantime, DOH is going to be suspending its regulations to allow existing hospitals to increase their space and capacity. DOH has regulations about how many beds per room, how much space between beds, et cetera, how wide a hallway has to be. Those are going to be suspended so hospitals can actually use their physical space with more efficiency. We're leaving it up to the hospitals for their discretion and prudence in making these decisions, but we do have to get very aggressive about them better using their existing space. I want the private hospitals to be on notice that we may soon be canceling elective surgery. We are not doing it now. Elective surgery is between 25% and 35% of the beds. Some of the elective surgery is critical. Some is not critical. The non-critical elective surgery may be canceled on a mandatory basis. I'm asking them now, as a precaution, to start to plan to cancel elective surgery that is not necessary. We will need that capacity in the hospitals when those numbers peak. Michael Dowling, who was the former health commissioner for the state of New York, a phenomenal fellow. He worked with my father and was in my father's administration. He was health commissioner. He was deputy secretary. He's just a jewel of a human being, and he's one of the best healthcare professionals in the United States of America. He runs Northwell now, which is a magnificent organization. But Michael and Ken Rasky runs Greater New York Hospital Association. They coordinate all the hospitals. I asked them to convene all the hospitals and now start developing the maximum surge capacity. So if a hospital's capacity is 500, okay, what if we bring in more beds? How many more beds can you hold? What if we brought in more staff, et cetera? We also have a number of efforts going on finding more staff, more doctors, et cetera, not just for the surge capacity, but also for the additional facilities we may open.